Morgan. I'm a student physical therapist. Today I'm going to be palpating some structures on your lower back and posterior pelvis. Is that okay?
Yes.
Do you mind if we record this for educational purposes?
No.
First I'm going to find the greater trochanter by sliding my palm up the side of her leg here till I find this bony protuberance to check. I'm going to flex the knee, internally and externally rotate the hip, and I can feel that bone moving right there. Next, I'm going to find the ischial tuberosity by sliding my palm up the back of her leg till I find that bony spot right here. And to check, I'm going to flex and extend the knee here to feel the hamstrings contract. Next, I'm going to find the iliac crest. This is usually the easiest structure to palpate. And once I have found it here, I can move my thumbs in, moving transversely to find the PSIS right here. This forms the dimples of the back. I'm going to hook my fingers underneath it, like so. From the PSIS, I'm going to move anteriorly and deeper to find the SI joint. I'm going to hook my fingers around the medial side of it and get as close as possible here. Okay? We're going to move medially from the PSIS. We are now at the base of the sacrum here at S1. It lies between the two PSIS structures. It is the wide, flat portion that supports the rest of the body from that point up. The apex can be palpated by moving inferiorly into the gluteal cleft. I'm going to move until I find the last bony structure, which we will guess is the apex. The coccyx is below this, but we can typically not palpate it. And back from the PSIS, here, we're going to move down the lateral border of the sacrum until we feel the inferior lateral border of the sacrum deep to the gluteal and lateral rotator muscle tissue here. Next, I'm going to palpate the 11th and 12th ribs. We're going to move superiorly from the iliac crest until I feel the next bony structure here. This is the 12th rib, and moving just superiorly, we will feel the 11th rib. To be sure I'm on the correct structures, I will have my partner take a deep breath in and out. Thank you. And when she does this, I can feel the ribs expanding. These are floating ribs, so they have no anterior attachment, and I will follow them medially to their attachment at T11 and T12. Following the 12th rib up to the spinous process of T12, we'll move inferiorly to find L1, L2, L3, L4, which is in line with our iliac crest, and L5 spinous processes.